Is the world's second most populous country prepared for an outbreak of coronavirus? India says it was among the first countries in the world to prepare for an outbreak of the respiratory disease, which has already killed more than 10,000 people and spread to 180 countries. Health Minister Harsh Vardhan says India began screening people at airports from 17 January onwards, 6 days after Chinese state media reported the first known death from an illness caused by the virus, and a good 2 weeks before the World Health Organization declared it a global health emergency. As of 6 March, India has reported 31 cases, the majority of them in the past few days. They include 16 Italian tourists. There's growing anxiety. Schools have begun sending out advisories. A few offices have shut temporarily after employees tested positive for COVID-19. By Tuesday, more than 600,000 people had been tested for the virus at the country's 21 airports and 77 seaports. More than 27,000 people living in 5 states near the border with neighbouring Nepal have been put under surveillance, and 1 million people tested in the area. India is setting up a screening lab in Iran to test returnees. The minister claims health workers are being trained for a potential outbreak, and isolation wards are being set up in state-run hospitals. By the end of the week, 34 labs across India will be testing for the virus, up from 15 so far. India has also stopped exports of N95 masks to make sure there are enough supplies at home. All this sounds impressive, but may still be not enough to prevent an outbreak. For one, the real extent of the spread of the infection may not be clear, despite the screening at air and sea ports. The incubation period between infection and showing any symptoms lasts up to 14 days. Some researchers say it may even be up to 24 days. Despite a creaky and uneven public healthcare system, India has a formidable record in defeating polio and facing up to a swine flu pandemic in 2009 and handling a more recent outbreak of the deadly Nipah virus. The National Polio Surveillance Project, a collaboration between the government and the WHO, is well known for community surveillance and contact testing, both of which are needed for effectively containing the spread of coronavirus. Authorities say health workers contacted nearly 450 people who had been in touch with 5 Indians who tested positive in 3 states. In the event of a major outbreak, India will face other challenges. The quality of its public health system is vastly uneven. Existing hospitals can be easily overwhelmed by a sudden spike in admissions. It is not clear whether there are ample supplies of masks, gloves, gowns, drugs and ventilators. Also, it would be near impossible for India to force its citizens into mass quarantine and hospitalize people in numbers like China. Virologists instead talk about an Indian solution, wherein prompt detection and effective triage ensure that milder infections are taken care of at home and hospital admissions are reserved strictly for critical patients. Also recommended are emergency operations centers at the federal and state levels, with special focus on states with weaker health systems. In the end, India needs to strategize nimbly and communicate openly and transparently to prevent the spread of infection. 24-hour hotlines, for example, where people can get more information about the situation. There's no reason to panic yet, as the health minister says. But India needs to be very vigilant and open about the spread and containment of the infection.